According to the Uganda Aids Commission report released in October 2023, the country's 2030 vision of eliminating AIDS as a public health threat hangs in balance due to the high prevalence of the virus among adolescents, particularly females, as well as the approximately 4,700 annual infections among newborn babies. According to UNAIDS 2021 report on Uganda, 89% of people living with HIV knew their status. More than 92% of those who knew their status were receiving antiretroviral therapy, and 95% of those on treatment were virally suppressed. These figures suggested that Uganda was on track to achieve the UNAIDS HIV treatment targets of a 95 to 95 ratio if progress could be sustained. Nonetheless, officials from the Commission insists that this target could have been achieved earlier if it weren't for several contributing factors, mainly the persistent stigma and discrimination faced by individuals living with HIV in the communities.
Stigma and discrimination. This still remains an issue in the national response, and it negatively impacts on HIV testing, it impacts on treatment, and also adherence to treatment.
It is on this basis that Dr. Ruth Ssenyonyi implored the public to desist from stigmatizing and discriminating HIV-positive members of the community.
So with less than 5 years to 2030, we need to focus on the following areas if we are to achieve the goal of ending AIDS as a public health threat. Stigma and discrimination results in refusal to go for HIV testing. You tell someone, let's have a test, and they say, no. How are they going to see me taking a test of HIV? They will think I've been misbehaving. It also leads to living in denial after the HIV test positive result. And it can also, this discrimination and stigma can lead to non-adherence to treatment. Sometimes you start the treatment and then someone says something and you say, I'll never go back to the clinic again. I am not taking medicine again because of that. So our request is that HIV stigma and discrimination is addressed at individual levels, at family levels, at community levels and country levels in order to create a stigma-free environment for people living with HIV.
Dr. Vincent Bagambe, who represented the Commission's Director General, stated that despite global funding constraints, partly prompted by the US executive order that suspended funding for AIDS programs in Africa, they have made significant progress. Bagambe adds that the government remains committed to providing uninterrupted access to antiretroviral treatment and HIV prevention strategies in pursuit of the country's 2030 vision.
We have agreed with the partners to ensure that services are not disrupted. And so in the period of the 3 months that we've been through this period of uncertainty, all government health facilities and all faith-based health facilities and non-government hospitals have continued to offer HIV services.
Jacqueline Makoko, UNAIDS Country Director in Uganda, urges authorities to prioritize domestically sustainable approaches in the fight against AIDS so that individuals living with HIV are not adversely affected even when global partners reconsider their funding priorities.
At this point in time where there is global funding shifts, I think there are 3 messages that I would like to leave with the media today. And one of it is that to truly end AIDS and save lives, the response must be truly domestically owned. And when we say domestically owned, we mean that the bulk of resources for the HIV response must come from domestic resources, because that's the only way we are going to sustain and make progress.
Paula Achaye, the Uganda National Students Association coordinator, appealed to the youth, particularly students, to take an active interest in policymaking and implementation, and to get involved in strategies aimed at combating HIV, noting that they represent the age group most affected by new transmissions.
I would like to invite young people to interest themselves in the fight against the spread of HIV and AIDS. Please be involved in your communities, in your institutions, in your societies. Get involved in advocating for policy change. Young people should get involved in the processes of taking decisions. that affect them. At every point, interest yourselves as a generation.
The government should engage people living with HIV in decision-making policies, because you can't decide for someone without listening from them. So the government should look into it. To the civil society organization, amplified advocacy. The civil society organization should amplify people living with HIV voices and their concerns.
Uganda bears one of the highest burdens of young people living with HIV in sub-Saharan Africa, with younger women accounting for nearly half of all new infections among females under the age of 2024. Although 2016 assessment indicated a decline in HIV prevalence among adults aged 15 to 49, the country continues to face significant challenges in eliminating mother-to-child transmission. Joseph Kabale, UCTV News.